Good morning, everyone. Welcome to MCCPOP Perinatal Potpourri 2021 Advances in Care. This is our 40th MCCPOP conference, and we are here to honor Dr. Phil Sunshine, who was the founder of MCCPOP many years ago, to bring good perinatal care to our community and our region. And Dr. Sunshine has been the coach for MCCPOP for the last 40 years. And if you look at this picture, it summarizes Dr. Sunshine's passions. On top, you'll see the Stanford logo. He's a Stanford fan, and he's also a Giants fan, and he has been our coach for 40 years. It's very hard to pay tribute to Dr. Sunshine because he's such a wonderful person, but I'm going to read to you a message from Dr. David Stevenson, who's a Senior Associate Dean for Maternal and Child Health and has known Dr. Sunshine for many, many years as a student, as a colleague. Phil is known by most of you for his humor and humanity, always ready with a good joke, but can assure you that he is also one of the most knowledgeable and finest physicians with whom I've worked in my career. He's my mentor, and he's the professional grandfather of all of us in neonatology at Stanford. He has taught us that the delivery room and the NICU are at the center of our professional universe, and our greatest privilege is to care for the babies and their families, no matter how dire their situation. He has challenged us to advance in the field, and with our colleagues in maternal fetal medicine, we have done just that for over half a century. He's a legend in our field and a local treasure. Thank you, Phil. I would just like to echo Dr. Stevenson's comments and say that it's been a wonderful experience working with Phil because of his absolute rigor in science, but also his humanity and his ability to connect with everybody across the spectrum, from medical students to nurses to attending physicians. And there's a wonderful link that you can go to, which summarizes the history of MCCPOP and basically shows you what Dr. Sunshine has done for the care of mothers and babies in the Bay Area and in our region for the last 50 years. His approachability and his ability to connect with all and everyone who is involved with care makes him a go-to person. He was always available for consultation, never spoke down to anyone, always treated people with great respect. And when we used to go on the road with MCCPOP, I've got so many anecdotes and jokes that he told me that if I collected them all, I could write a really nice book. But again, as a physician, and that big smile of his always made him a favorite with the patients and with the parents, obviously. The patients obviously couldn't connect with him, but this man is a legend, he's a treasure, and we are so happy that he's with us today to celebrate this wonderful occasion. Now that I've said some really nice things about him, I'm turning it over to Dr. Cohen, who hopefully will give us some of the other side of Dr. Sunshine. Dr. Cohen.
Well, thank you very much, Maury. There really isn't another side to Dr. Sunshine, but I would like to share one story. And to say that Phil has been a major figure in my life is a major understatement. He may be just about the most major figure in my life. There are very few people in my life that I can recount with detail the first moment I met them. But with Phil, I can, and it was actually slightly more than 40 years ago. I was a very green young intern rotating in the NICU at, of all places, UCSF. And I had been on call all night. So I was the first person there in the morning, and I was standing around the entryway waiting for rounds to start. And this gentleman walked in wearing white tennis sneakers, khaki pants, and a blue Oxford shirt. Came up to me and asked if I was the fellow. And I said, no, I'm the intern. So he held out his hand and said, hi, I'm Phil. I shook his hand and said, "Hi, I'm Ron." And he started talking to me, and I'm going, "Who the heck is this Phil guy? Is he one of the parents? Is he what is he doing here? Who is he?" A few minutes after that, in came Professor Dr. William Tooley, who was in charge of the NICU at UCSF, all about 6'4" of him. And he came in and he gave Phil a big greeting and a big hug. And now I'm really going, who is this guy? What is this? And then we started on rounds. And I started to realize that this guy was not a parent. He was not one of the housekeeping crew. He actually seemed to know a fair amount about neonatology. And Dr. Tooley was asking him questions and soliciting and appreciating his input about the patients. And rounds went on, and I kept looking at this guy and thinking, wow, he really knows what he's talking about. Who is this guy? Finally, rounds broke up, and he said goodbye to everybody, shook my hand, said, "Nice to meet you," and left. And I turned around, and I finally said out loud, "Who was that guy?" And when they told me it was the legend, Phil Sunshine, it totally blew my mind. And the reason I tell this story is that not only was this the first time I ever met Phil, and it left obviously a lasting impression on me, but I can't tell you how many people will virtually tell you the same damn story, because that story embodies Phil. He is the same person to everybody, whether you're the intern or whether you're the famous Dr. Tooley, whether you're the parent, whether you're the cafeteria worker. It makes no difference. Phil is genuine Phil. He is warm. He is open. He is there for you. He cares about you. He engages you. And I can't tell you how many people who will tell you almost the same story, right down to the white tennis shoes that, by the way, he's wearing in Maurice's picture to this day, 40 odd years later. So that's Phil. He is just an ordinary, great guy for everybody who has ever met him. And he is always the same to all people. And in my book, that makes him a very special person, because even in the small pool that is neonatology, where he is a very big fish, he swims right along with the rest of us and doesn't ever pull rank or anything like that. He's just a great guy. And like I said, so many people will tell you almost the same story that I had to share it. I'll tell you one other quick story about Phil. I'm a beginning fellow, first-year fellow, one of my first rotations in the NICU, and Phil had been invited to give a talk someplace exotic, someplace far away. I forget. Maybe it was Malaysia or Indonesia or someplace far away. And he was leaving me all alone in the NICU. And I turned to Phil and I said, "Phil, you going to leave me here alone?" He says, "It's okay, Ron. You can handle it. I'll be gone. You'll be in charge. Do whatever you want. Just one word of advice. Whatever you do, don't mess up." Again, I can assure you, I thought that was something Phil had just invented to say to me, but it isn't, because most people who've worked with Phil will tell you he gave them that same brilliant words of advice. But what it really was words of confidence. "You can handle this, Ron. I trust you." And with a smile, pat on the back, "Do whatever you want. Just don't mess up. See ya." And that was Phil. His calm, "You're in charge. You're okay. You can do it." And like I said, I'm not the only one who can tell that story. It goes on for all of us who've worked with Phil over the years. A great leader, a pioneer in our field, but most importantly, a great friend to everybody who has ever crossed his path. And that's a skill and a talent that few of us have like Phil does. So Phil, it's been a great 40 odd years. Some of those years pretty odd. And congratulations. And so glad to have you here with us today, sharing in this session, number 40. I'm going to turn back now to Dr. Druzin, who will make some announcements and housekeeping statements to get our sessions rolling. Dr. Druzin.
Thank you, Ron. And again, thank you, Phil. So here's some announcements, how to participate during the webinar. You can just follow along. utilize the Q&A function for each session. The chat function is disabled. Next. And to access our presentations, they are all available for you to access. So here are the directions. And we've had some financial support from the following companies. Within a week of the webinar, you will receive an email to assess the course evaluation. And within the evaluation, you'll be asked to attest your hours of participation, and then the transcript will be updated with the appropriate CME hours. And here's the agenda for today. We will have the morning session starts at 8:15 and ends at 9:55 for a break. We'll then have the second morning session followed by the midday break, and then we'll go into the afternoon. So without further ado, I would like to introduce the speakers. The first speaker is going to be Dr. Melissa Scala, who is a clinical associate professor in neonatal and developmental medicine. Melissa, based on her interest in premature birth and newborns, along with several other faculty, recently developed a mobile app designed to educate, engage, and empower women at risk of preterm birth, leveraging mobile technology to mitigate social disadvantage in the NICU and beyond. And our second speaker is a colleague of mine, a very valued and dear colleague, Dr. Virginia Nguyen, who's an associate professor of OBGYN and reproductive stem biology. Virginia is an MD PhD. She is an outstanding clinician and an outstanding scientist, which is a rare combination, but we are so lucky to have her. She's an executive member of our Maternal and Child Health Research Institute, and he's also a member of BioX, which is Stanford's Interdisciplinary Biosciences Institute, which also develops new devices. She's recently published on the clinical features of SARS-CoV-2 infection during pregnancy and associated placental pathologies, but she's also the co-PI of a major NIH grant, which is looking at later in life sequelae associated with pregnancy complications, specifically cardiovascular disease and the association with preeclampsia. This is going to be a major contribution to the health of our patients, not only during the pregnancy, but certainly beyond that time, as we know that there's an increased risk of cardiovascular disease in women who've experienced preeclampsia. So, well, we've introduced the speakers, and I believe that we are close to starting the morning session. So I'm going to hand it back to Melissa to bring up the slides and hear from Dr. Scala. We have a minute left to everybody get themselves settled. Thank you everybody for coming, and thank you. Looking forward to a wonderful presentation. And I'm sorry that we're not personally in Monterey, although behind me is the beautiful Monterey Bay. And hopefully next year we will be back in person at our usual haunt, and we can have a great time. Thank you again and have a great day.